My name is Grace Shing. I'm the head of audiology at the Western Institute for the Deaf and Hard of Hearing. An audiologist can work in a variety of different settings. In British Columbia, they can work in hospitals, public health units, private hearing aid clinics. WorkSafe BC also has a hearing conservation branch, and there are a lot of other different opportunities for them in the school system as well. Audiologists work with a wide variety of populations, ranging from newborns all the way to seniors. They can work with school children and working adults. And depending on the setting, the interaction that they have with the various clients will vary. To see an audiologist, many times you do not need to have a formal referral. So if you have a concern with hearing loss, most clients can contact an audiologist through the yellow pages or through the internet and contact them for a hearing test, and no referral is necessary. However, if you see a doctor or your doctor refers you to an ear, nose, and throat specialist and refers you then to see an audiologist, in those cases you do need to have a referral from a physician. Audiologists work in a variety of different settings. Sometimes audiologists can be sole charge. They may work by themselves or with other colleagues in a hearing clinic where they are the sole provider of hearing services. But in other settings, such as in hospitals or public health units or in the school system, many times audiologists may work in a team with other professionals to make sure that proper care as it relates to hearing and communication is properly provided to the client. In other situations, such as WorkSafe BC, audiologists may work with claims officers. In private clinics, while audiologists may work by themselves in a clinic, they may often have to contact other professionals in that client's life to help with communication issues. For example, if your client goes to social environments if your client goes to social activities in a community center where there is a nurse or a physical therapist, then certainly an audiologist may want to work with that professional to make sure the client is able to hear and understand well in those environments. Audiologists work with a wide variety of professionals, ranging from medical doctors such as ear, nose, and throat specialists and general practitioners, but also nurses, care aides, speech-language pathologists, physical therapists, occupational therapists, teachers, and a whole host of variety of different professions. In addition, many times audiologists need to work closely with family members as well to ensure that the client's needs are met in a wide variety of listening environments. It's very important for audiologists to know the role of other healthcare professionals. Many audiologists work in environments where they're serving an older population. And as the population ages, many seniors are needing healthcare in a team approach. In fact, Statistics Canada estimates that by the year 2025, 1 in 4 Canadians will be a senior. And the prevalence of hearing loss right now is approximately 10% of the population, but that number rises to over 50% of the population in age groups of 65 years of age and older. So in about 15 years, just about every Canadian will either be working or know someone who has some degree of hearing loss, or they may be experiencing it themselves. Therefore, audiologists need to know if their client is working with other healthcare professionals to make sure that they're able to receive information from these other professionals appropriately, and to ensure that these professionals, in how they interact with their clients, are also communicating effectively with the person with hearing loss. Hearing loss is one of those diseases that really isolates a person from one's own community. And as humans, we need to communicate to have a sense of belonging and be part of a society. And left untreated, hearing loss can lead to feelings of isolation, depression, withdrawal. Therefore, an audiologist needs to know that if a client is working with other professionals, be it a doctor, a nurse, a physiotherapist, or an occupational therapist, that whatever their roles are, the client is interacting appropriately with those professionals and ensuring they're hearing everything that person is saying and making sure their client is using appropriate strategies in those environments.